Welcome back to our channel. Today we are going to dive into a fascinating medical case involving a 45-year-old man whose journey began with a simple headache and blurry vision. Stay tuned to find out how this seemingly ordinary symptom led to a life-saving surgery. Our story begins with a 45-year-old man, previously healthy, who suddenly started developing intermittent headaches and blurry vision. It didn't seem like a big deal at first, but little did he know that his body was hiding a dark secret. 2 months prior to these headaches, patient had a bout of fever. Now the headaches were getting worse and his vision was more blurry than ever. He also noticed that his neck was getting stiff, making it difficult for him to move. Because of the symptoms, he went to his doctor. So the doctor conducted several exams. He noticed that his neck was definitely rigid. He also did an exam called fundoscopy, where they look at the back of your eyes in the retina. The patient's fundus exam was unremarkable. Further testing and workup was done. The doctor performed a test called lumbar puncture to look at his cerebrospinal fluid, CSF, the fluid that surrounds brain and spinal cord. CSF testing showed increase in lymphocytes, a type of white blood cells, protein, and low sugars. CSF also came back positive for Cryptococcus antigen. Other tests included TB, which came back negative. Because of Cryptococcus, patient was also tested for immunocompromising conditions such as HIV, which was negative. Patient's hemoglobin A1C was also normal, ruling out diabetes. After this, patient underwent imaging, which included CT and brain MRI. CT scan showed an enhancing lesion in his temporal lobe with surrounding edema. Same thing was seen on MRI. Patient also underwent fungal culture from the CSF, and this test came back by growing Cryptococcus cati, a type of organism that typically affects immunocompromised hosts. Because of this finding, patient was immediately started on antifungal called liposomal amphotericin B, which is an IV or intravenous antifungal medicine given to patients with this type of infection. Patient did well and was sent home. However, in the coming weeks, patient developed worsening headaches and more severe symptoms. After coming back to the hospital, he underwent another MRI that showed increased edema and dangerous midline shift. Patient was immediately taken to the OR to carry out decompression craniotomy to remove the space-occupying lesion. After the surgery, patient did exceptionally well. Patient was discharged home. Final pathology from the resection confirmed the presence of cryptococci, revealing a cryptococcal abscess. After the surgery, patient recovered well. After 2 weeks, his condition significantly improved. His blurry vision and headaches were completely under control. This case highlights the importance of brain abscess with Cryptococcus even in immunocompetent host without underlying HIV or diabetes, etc. Although this is extremely rare, this has to be considered, and doctors and medical team have to consider this as a possibility when patients present with headaches and blurry vision. This case also reminds us of the importance of paying attention to our bodies and seeking medical help when somebody feels off. If you enjoyed this medical mystery and want to see more fascinating cases, don't forget to like, subscribe, and hit the bell icon for notifications. Stay healthy and stay curious.